Welcome, everyone. Now, before we begin today's session, I would just like to note that this session will be presented in English and in Portuguese. There is an option for live French and Portuguese interpretation, as well as an English option as well. If you would like to access the French, Portuguese, or English audio channel, you will find a globe icon in the bottom of your menu bar in your Zoom screen that will allow you to change the channel from English to French or to Portuguese. Or if a panelist is presenting in Portuguese, you are able to use the same tool to change your audio channel to hear the English interpretation as well. If you have any other questions, please be sure to add those to the chat and our production team will follow up with you. Now, welcome to our second technical panel and our technical panel webinar series at this year's Global Child Nutrition Forum, School Feeding as a Tool to Fight Hunger, even when schools are closed. We're excited to bring this panel to you in a virtual setting and to a much wider audience than we've had in the past. As was noted in last year's communique, it was more important than ever that we find opportunities to allow ourselves to virtually collaborate and share resources easily around the world, and how little we knew how prescient that goal of ours would be. So here we are today, 1 year later, after a forum saw 370 participants join us from 70 countries around the world at a virtual forum, now bringing together twice that amount of individuals with a large country representation from all over the world joining us for both our live and our recorded sessions. Today's panel will be moderated by Ms. Bibi Giyose, the Secretariat with NEPAD, who will be introducing not only our panelists, but also our session theme. I will now turn the session over to Ms. Bibi, and thank you all for have joined us for today's live session recording.
Thank you very much, Ryan, for the kind introduction, and thank you, Arlene, for bringing me on board as a very avid supporter of the GCNF over the years. It gives me great pleasure, ladies and gentlemen, colleagues from around the world, good afternoon, good morning, and good evening. As already introduced, I will be the moderator for this year's GCNF, which unfortunately, due to some unprecedented circumstances and pandemic, COVID-19, we have to convene this session virtually. But bearing in mind that the advantage is that we can have more people participating across the various time zones. I would be remiss if at the outset I do not recognize and thank the mother, the forever present champion, the heroine, the voice of reason of GCNF and the forum. None other than herself, Jean White. Jeannie, good afternoon, and we welcome you, we miss you. However, your leadership has always been that pillar of strength for all of us on the issues that are very pertinent for child development, for health, nutrition, through the use of school meals, and for engaging as wide a community as possible. We all salute and thank you immensely as a global family. Now, ladies and gentlemen, on to the business of the day. Let me just highlight, as Ryan said, that this year's theme is about understanding and having a conversation around how we can effectively deliver school meals even in these challenging times. So, we have in our midst, gracing our virtual stage, and as panelists, 4 really exquisite speakers and experts from around the world. These people have a wealth of information around exactly what we are about to be listening to, discussing, and ensuring that we get a handle on how we move forward during this COVID in the intermediate effect and time, and also in the long term for sustainability. We have Carmen, we have Rafael, we have Cindy, and we have Karine. I shall be introducing them individually as they get ready to make their interventions. Kindly note that each speaker, panelist, will have about 10 minutes allocated for their primary intervention, after which, based on what I've heard and what we have had, I may pose some very specific probing questions so that we get to the heart of the matter. After the 4 interventions, we will have an open Q&A in the manner of a chat box as well as the Q&A box. So now, by way of introducing the subject, I'm going to tee off the conversation with 2 main questions to our distinguished panelists. The first question is addressing itself around policy and the guidelines necessary to support the programs and reach children under these current and challenging circumstances of COVID-19. And the second question that I would like them to address is around precisely what programmatic opportunities COVID-19 presents. As we know, COVID-19 has actually had us thinking and rethinking our approaches alongside policy, program implementation, and indeed monitoring and evaluation. So, ladies and gentlemen, let me now, without further ado, turn on to our first presenter, Ms. Carmen Burbano de Lara, a long-standing friend of mine. We've been through thick and thin in this journey, and I've known Carmen for so many years. Not that we're old friends. We're not old. We're just growing younger. So Carmen's talk is going to be focusing on the global impact of COVID-19 of food systems, child nutrition, and access to school meals. And with her lens of the World Food Programme response, e.g. the traditional school meals, we would like to hear some updates and lessons from the last 8 months. Everybody knows Carmen. I need not go into detail, but I'd just like to appreciate her expanse knowledge of the subject matter as the World Food Programme Director of the School Feeding Division, which was actually started just less than 2 years ago. She's based in Rome, Italy, over 14 years experience with WFP, amongst other regional, international, programs. So Carmen, may I hand over to you to lead us not into temptation, but into a very interesting presentation and discussion there. Over to you.
Thank you so much, Bibi, for that wonderful introduction and keeping us all very interested in this session. I want to first, of course, thank GCNF for organizing this forum this year. We've all been participating in virtual events and conferences and webinars over the last few months, and we know how difficult it is to pivot to this new environment that we're working in. So I just want to congratulate GCNF for not giving up this year and keeping up the tradition of making space for us to discuss these really important issues, and thank us, GCNF, for inviting me and WFP to participate. I've been given the task, as Bibi has said, to really kick us off in this conversation, and my objective in discussing with you today is really getting us thinking a little bit about the impact that COVID has had on school children. And I know that most of the people listening in this session today are people that are already very much interested and concerned about what's happening. So let me just jump very, very quickly into the session. Hopefully you can see my screen.
Yes, we can.
Okay, wonderful. And I'm trying to put it on, okay.
The presentation mode, yeah.
Yeah, is it in presentation? Yes, okay. So one of the first things that I just wanted to mention, as the World Food Programme, we have been participating over the last few months in all of the major discussions around the education sector internationally, that has very much been put on alert. And one of my main messages today is that it is very clear to us in the World Food Program, but in general for the international community, that we are looking at a catastrophic situation for education and for children that we have really never seen before, or at least not in our generation, in our lifetime. At the peak of the crisis, as we all know, about 90% of school children were sent home because of the school closures. And this created and exacerbated a lot of inequalities that were already existing in a system that was already struggling to teach children and to facilitate learning. So even before the pandemic, we were already concerned about learning outcomes. We were already concerned about children that were going to school, were probably 10 years old and couldn't read a sentence. And the pandemic hit right in the middle of that already exacerbated situation. Some children have continued to learn because they have had access to online materials, they have access to internet, they have access to computers. And many, many, many others have simply stopped learning over the last few months. And that is what we are most concerned about. We are looking at a potential entire generation of children that will really never recover from this crisis. Some of them will never even come back to school, especially we're concerned about girls, but not just about girls, children living with disabilities, children living in conflict situations, in fragile situations, and in households that are very poor. We know that when families face shocks, such as the one created by the pandemic, when parents are losing their jobs, when families are scrapping for food every day, they recur to really drastic measures, like, for example, putting their children to work, like marrying off their girls, like other kinds of coping strategies, as we call them, to simply survive. And so in the communities and in the countries where the World Food Program especially is concerned about, we are seeing more and more these effects the longer the schools remain closed. So I just want to share with you here, this slide. You can see we have been busy as the UN system since the start of the pandemic, providing analysis to governments, to partners, to our own offices, to basically make sense out of the situation. And here you have a collection of some of the publications that have come out, and I'm sharing this with you because those of us listening today might find these guidance pieces and these analyses useful. UNICEF, WFP, and FAO issued specific guidance, the one you have on the left, around mitigating the effects of the COVID pandemic on children, specifically around issues related to school feeding. So this is a particularly important piece that is that might be useful to this audience. And then we have in the middle general analyses of the education sector. 2 policy briefs that were issued by the Secretary General, very much aligned with this concern about the impact of the pandemic on school children and what we're seeing in around the world. And then we have a very important document, the one you have in the middle, which was issued by UNESCO, UNICEF, the World Bank, and WFP, which has been translated in many languages and has now really been used by a lot of governments. It's a framework for reopening schools and contains a lot of information, best practices, and suggestions, recommendations for governments and their partners on what to consider when reopening the schools. The latest document that we have just published as a partnership with more than 10 agencies is the Save Our Future white paper that was published last week, which really sounds the alarm of the education sector and summarizes the concerns that we have as the international community, really looking at this as a catastrophic situation. One of the major messages as we have gone through the pandemic is that children are not only missing out on their education. There is an aspect that's really important about the well-being of children that has also gained a lot of importance. Their health, their nutrition, their psychosocial well-being, their protection and their security, all of those things are at risk. And the white paper recognizes this and recognizes, as he has been saying for a while now, that we need to focus on the learning, but we also need to focus on the learner and whether children are safe and whether they are healthy and how they're faring, especially during a crisis like this one. Our main preoccupation from the World Food Program, particularly, of course, has been the loss of access to meals. And I'll show you the map, which a lot of you may be very familiar with. This is a mechanism that the World Food Program put up just as the crisis started in March and April. The number of children missing out on school meals at the height of the crisis, these are May numbers, May 2020 numbers, were that around 370 million children were missing out on these meals in almost every country in the world. Now, these figures have changed. They are not as high as they were at the top of the crisis, but very concerningly, they haven't really gone down as much as we wanted to, meaning that we still have a large number of children that are still missing out on school meals, particularly because the reopening process of different school systems in different countries have been a little bit uneven. And as the situation continues and as governments make these decisions, of course, these choices have been quite difficult. Now, while schools have been closed, we have worked with governments and we have seen all around the world very creative ways of retooling and pivoting these programs to make sure that children continue to receive food even while they're at home. We see most of the countries using what we call take-home rations, which basically means that instead of getting the food in the school as they used to, the government and partners like WFP and other NGOs have been repackaging this food and providing it to children at their homes. This is the case for almost all the countries that WFP supports, but also many of the countries in the developed world, like the US and others. But there are other strategies that have also been used. For example, the use of vouchers, a very important mechanism that has been used in Costa Rica, for example, and in the UK, and also the ramp up of cash transfers so that children and their families can continue to have money to buy the food that the children used to receive in school. So there have been mitigating strategies that governments have used. We, as WFP, have reached about 7 million children during the pandemic with alternative mechanisms, making sure that they continue to receive food. But even with these efforts, and even with the titanic efforts that governments have made to continue supporting children with school feeding, we are concerned that we still don't see the numbers of children receiving school meals as we did in the pre-pandemic levels. That means that a lot of children are missing out and falling through the cracks. So as we start reopening the schools, one of the things that we have seen as well is that governments are using programs like school feeding as a key incentive to bring children back to school. And we see that, for example, in Mali, we see that in countries like Cote d'Ivoire and others that have opened up their education systems and restored access to meals as a way to bring children back. In certain countries like Niger, for example, and Chad and others, we also see a creative mechanism through which governments have attached cash transfers or vouchers as additional incentives for particular children that might never come back to school without them. And here I'm talking about girls and other children that are considered vulnerable in specific contexts. So the lesson here also is that school feeding programs are not just important to sustain children's nutritional status and health, although of course that's one of the primary mechanisms, but they are crucial incentives at this moment when families need support the most to ensure that they bring their children back to school. So I wanted to close by perhaps sharing with you some of the recommendations moving forward that the World Food Program has for governments, for our partners. One, of course, is to continue to support children with meals while schools remain closed. And as we were saying, in many parts of the world, this is still the case. And while schools are closed, children need to continue to receive this kind of support. Increasingly, we are seeing guidelines from the WHO that really keeping schools closed and continuing with a policy of keeping schools closed is just exacerbating inequalities. And the evidence is showing us that really children don't appear, school children don't appear to be big transmitters of the virus or vectors of transmission.
IT, may you please?
Yeah. So it is really important to reopen schools and restore access to meals as we do. As I was saying, evaluate whether additional mechanisms can be put in place to support specific groups of children, like girls, with additional incentives, and really importantly, work with ministries of education to help them protect education sector budgets, including school feeding in those budgets, to make sure that we don't have more and more children without these vital support systems. Thank you so much, Bibi.
Thank you so much, Carmen, for being very succinct. I mean, I like your messaging around the fact that countries have to rethink and retool and pivot towards reshaping their policies and their programming by way of ensuring that, even during the school closures, kids that need that one meal, very important meal, can still have access through a take-home ration, through vouchers or cash transfers. So this is a very, very important lesson to take on board and to ensure that, kids are not psychosocially negatively affected by the school closures and by not having that one very important meal, as well as other services that are associated with the school as an ideal environment. So thank you once again. I shall come back to you with a couple of things I heard. So moving right forward, ladies and gentlemen, we have Rafael Fabrega, who is with Tetra Laval. Rafael is the director of Tetra Laval Food for Development based in Stockholm, Sweden, and responsible for leadership for value-added support and customers and partnerships across for sustainable school feeding. Rafael is going to be speaking to us on some learnings about providing school milk during the pandemic with a focus on the private sector, obviously, and how the private sector has been committed through different partnerships with very specific examples, that, we shall be listening intently on and with a lot of interest. So without further ado, may I call upon you, Rafael? You have the floor.
Thank you, Bibi, for the introduction. Before I begin, I would like to give a very special thanks to GCNF for this wonderful initiative and for keeping the spirit of the forum alive with the virtual forum this year. I would also like to recognize our customers and the exemplary work that they are doing in collaboration with local authorities and with NGOs by implementing alternative distribution and safe distribution solutions for the children, despite all the school closures we're seeing. And finally, I'd also like to thank organizations such as the WFP, USDA, and FD&E for sharing important data and examples of the work they are doing as well. And once again, congratulations to the World Food Program on being awarded the Nobel Peace Prize for their commitment on the fight against hunger. Well done. I'll start by providing a brief introduction about ourselves, just to give some context of our purpose and what we do. And then I'll provide some examples of countries that have been implementing alternative distribution solutions, as well as an overall update and the current situation and key learnings. Tetra Laval Group consists of 3 industry groups. They are Tetra Pak, Sidel, and De Laval. I'll focus on technologies for the efficient production, processing, and packaging of foods. We cover the entire food value chain. Of the 3 industry groups, Tetra Pak in particular has a long history and tradition supporting our customers and working in collaboration with governments, UN agencies, NGOs, and international aid agencies around the world in the development of school feeding and nutrition programs that are linked to local agriculture development. And today, more than 68 million children in 56 countries receive milk or other nutritious beverages in Tetra Pak packages in their schools. Our vision is that we commit to making food safe and available everywhere. And our brand promise is protects what's good. The vision is what really defines our purpose and what has been driving our work in school feeding and nutrition programs throughout the years. Our priority focus is on food safety. We provide technical assistance and share best practices used in school feeding programs around the world. For example, we have a school feeding specialist pictured here. He has provided technical support and training in more than 42 countries. The training and technical assistance we provide covers a wide range of practical on-the-ground support, ranging from distribution, food safety training, administrative setup of programs, school selection and preparation, all the way through impact collection and data knowledge sharing. Now, having worked in many countries around the world, we know that there are already many existing challenges when it comes to the practical and safe distribution of food. For example, we find many situations where there's a lack of electricity, there's no kitchens to prepare the school meals, lack of potable water, deficient infrastructure in schools, and sometimes many cases you have to look for alternative distribution routes as the roads are not well kept. And then you have also seasonal challenges such as flooding during the rainy season. And now the COVID-19 has presented a whole new entire challenge. And this has really highlighted the need and the critical role for improved food safety when delivering food to the children when the schools are closed. Now, since March of this year, 35 of the 56 countries where we participate have been able to implement alternative ways to distribute food to the children during all the school closures. Most of the countries that weren't delivering are in Europe, but this also had to do with their summer break until August. But now many schools are reopening in Europe, and we see more countries that are delivering food. However, the number of cases are rising in Europe, and as you may know, so we're monitoring that situation as it unfolds here. But across the world, we have seen a lot of countries, I think as Carmen alluded to, have really done a great job of looking for alternative ways to deliver food to the children despite all the school closures. Now I'll provide a few examples. Please note that in the presentation, given the time, I don't have time to go through so many of the examples. We do have a lot more, and I will upload the presentation afterwards with more examples. But I just want to give you a few examples of across the world so you can get a little bit of a feeling of or see how they're all doing. In China, the Tetra Pak has been actively working with their customers, with the Ministry of Education and the Dairy Association of China to ensure the delivery of school milk. They had implemented two methods in place. One was where the parents could pick up the milk from schools as a take-home ration, and also they implemented online orders systems with non-contact delivery. Basically, how this worked is that the students' general ID, general information, I should say, and their ID, school, class, and parents' contact number were provided. The delivery person would store the milk in a designated storage cabinets pictured here. They were provided a password to the parents. Then the parents could go, with that password, could go pick up the milk at the storage cabinets, and thus there was no contact face-to-face handover of the milk within that. Here is an example of the training and order instructions for the home deliveries that were provided to the parents. Our customers also made donations of UHT milk to schools. They also made donations of PPP equipment as well. The update in China is that many of the schools have been reopening now. They have implemented biosecurity protocols in place, and they're doing temperature checks and also using the PPP equipment in the schools. In the Dominican Republic, we have another example where the government, or the INABIE, the National Institute of Student Wellbeing, established a mechanism so that the families of the students could go pick up the school milk from the education centers on a scheduled basis. The government had mandated that the school feeding program continue. However, they did implement various protocols in place, such as a maximum number of parents per school at a time. They implemented protocols such as social distancing with no more than 10 people. The schools were also cleaned and hygiene protocols were established. Now the schools there remain closed and they are doing remote learning, but the food is still being distributed in this way. In El Salvador, we have a great example where the Ministry of Education was overseeing all of the food deliveries through containment centers. They were delivering UHT milk, rice, beans, and cereals that are part of their school feeding program through these containment centers. They prioritize vulnerable communities and they implemented hygiene protocols using the PPE equipment and verification of the process of recipients were established, the tracking of the products and the tracking of the beneficiaries to make sure that they have their proper identification and guidelines have been in place. The situation here is that the schools remain closed. However, the Ministry of Education has taken the time during the school closures to renovate a lot of the schools. And then, of course, when the school opens later next year, hopefully, then these protocols will continue. In India, we have another very good example of where the states are providing milk, fruits, and vegetables and other ingredients used in the midday meal scheme, but they are delivering to the homes of the children. They have approved vendors that are tracking the deliveries to all the registered beneficiaries, and the staff that worked also in the preschools are helping with all the deliveries to the schools. And they're using barcodes, for example, to track all the deliveries and the beneficiaries to register all their information. And they're using this modality and the coverage is expanding. Now in India, the schools will be reopened in phases. So there is a plan for that in place. But in the meantime, the food deliveries continue. And the last example is a very interesting example in Peru, where the Air Force worked very closely with the MIDIS, which is the Ministry of Development and Social Inclusion, which is running the Kaliwarma school feeding program. They have airlifted food in various places, including here, as you see in the Amazon, so that the children can continue to receive their nutrition. In this case, the families will go and pick up the food at the schools. The food is being delivered to the schools, and they have all of the registered beneficiaries from the program, from all the schools, and they're tracking all the deliveries there. So this is a great example of how, no matter how far you are, or the difficult challenges to address that, then there's many ways to deliver the food. And overall, just like to highlight some key learnings that we have overall here. Basically, we have seen a lot of disruption in the food value chain. However, it has really, the resiliency of the food value chain has been maintained. A lot of work has been put into ensuring that the food still reaches those in need, despite so many disruptions across the value chain. The pandemic has also highlighted the need for more investment in health, education, and agriculture, all of which are directly linked to school feeding programs. We have seen a very good collaboration among key stakeholders to implement alternative and safe distribution solutions, some of the examples that I mentioned. Of course, the shared learnings and global experiences have been key, such as we are doing now. Of course, and then the implementation of policy guidelines and protocols and documenting everything is so important for the long term. So we learn from this and continue to implement the processes in the future. And finally, the increased need for technology to facilitate all the administrative functions, communication, oversight, distribution, and logistics. It's so important so that there's better coordination and we can tackle the challenges immediately when they happen. And before I finalize, I would just like to take this moment to give a special thanks and recognition to our colleagues around the world who have been working around the clock and really making a difference supporting our customers to ensure that the food supply is maintained and that the children can continue to receive safe nutrition during these very difficult times. Thank you very much.
Thank you very much, Rafael. I mean, I like particularly the fact that in your examples, you've actually traversed the world and covered different countries that are in terms of scale, in terms of location precisely, in terms of their infrastructure challenges, but more importantly, in terms of their socio and economic standing. So this gives us a good perspective of how different countries can manage and collaborate with the private sector to deliver safe, available, of course, safe, it has to be available as well, and everywhere. So I have had an example from Africa, but I have a question for you, I mean, later on around that, just so that we have a balance in the approach and in the different, cultural and socioeconomic standing. So once again, thank you very much for highlighting the key issues around, the packaging, the delivery, and the aggregation and collection, because that's a very important element of how you can have a mechanism that is on point, functional, and really delivers on what it should at the right time for the right reasons and with the right impact. So once again, thank you very much, Rafael.
Thank you.
Ladies and gentlemen, moving right along, now traversing the world again to the United States, we have Miss Cindy Long from the United States Department of Agriculture. Cindy is well known to many of us and has done a lot of work in the department as the Deputy Administrator for Child Nutrition Programs of the Food and Nutrition Services within the USDA. She's been responsible for the federal administration and child nutrition programs all the way from school feeding to school lunch programs, school breakfast, the adult care, the summer programs, you name it. She's all wrapped in one in addressing all these issues. So Cindy this afternoon is going to be talking to us about some of the updates in USDA's school feeding response to COVID-19, while also highlighting some modifications to the existing programs so that they can be retrofitted and can address some of the policy and programming challenges and the delivery mechanisms. So Cindy, without further ado, over to you. You have the floor.
Thank you very much, Bibi, and thank you to GCNF for hosting today's session. So I am going to briefly take a few minutes this morning to cover the U.S. response to school feeding. And specifically, we can think of our response as falling into two categories. The first is modifications to existing school programs, and the second is actually the creation of new program options. But before I get into the specific program descriptions, I should point out that most of the actions I'm about to describe are available because of action by the legislative branch. Because our programs are federal and established by federal law, significant changes to these programs require action by Congress. Congress has passed several bills to address the COVID crisis. The Families First Coronavirus Response Act was the first and passed in March, and it provided the basis for most of what I will discuss today and provided a very substantial increase in funding for these programs, which is so important. While the Congress hasn't yet passed another COVID relief bill, it did provide in a recent budget action some ability for USDA to continue with many of the actions that we are taking. Let me start with what occurred last spring. In early to mid-March, schools began closing due to COVID-19, and fairly rapidly, virtually all of the schools in the nation were closed. While we didn't know it at the time, these closures ended up lasting for the remainder of the school year. To understand the challenges, it is important to know that in regular circumstances, our school meals programs are based on a congregate feeding model children are served in group settings at school. I'm just going to pause because I feel like we're having some technical challenges and just check in. Are folks, can someone confirm that folks can see the slides?
Yes, we can see them. Well
Excellent,
projected.
thank you. Let me continue. Thank you. So one of our critical early steps was to really modify some of the requirements that were in place for our programs under normal conditions. The first had to do with getting rid of requirements that are associated with the model that has children being served in cafeterias. This allowed schools to develop pickup-based or home delivery models. In pickup models, like the one shown here, families could come and obtain meals for their children when they were in school. They allowed for things like multiple meals being picked up at one time, for adults to obtain meals for their children. And all of these measures were intended to allow for the provision of meals within social distancing. Many schools were very innovative in structuring their pickups to minimize contact, including drive-up models and things like using school buses to drop off meals to homes or points in the community. Another key issue in the US had to do with student eligibility. Under our standard program, schools, with some exceptions, schools have to determine the income status of children. And depending on their status, they receive meals either for free or have to pay something. And the funding schools receive is tied to that eligibility determination. However, during the spring, we gradually allowed schools to expand the availability of free meals to all children. And this eventually reached the point where this was available in every state. And this reflected an increasing recognition that the economic circumstances on the ground were changing so rapidly that individual eligibility determinations were not practical. We've also provided states with the ability to allow flexibility in meeting meal pattern requirements. So that was phase one. Now to move on to phase two. This is the time that we moved to back to school planning. The models I just described were in place through the end of last school year, which ends in mid-June in the US. During the summer, all of these flexibilities also applied to our summer feeding programs. During the past summer, we continued the availability of these meals to be available for free in all communities. And so during the summer at USDA, our thoughts turned to planning for the school year. Originally, we had hoped, like so many, that schools could return to in-person operations with social distancing and other precautionary models. So we planned for a return to the traditional school model with some flexibilities still being available, including things like providing meals through pickup or somewhere outside of the cafeteria. But we did anticipate returning to the standard aspects of our programs, including the means testing piece. But as we moved to phase three, when schools actually went back to school, and it became, as the end of the summer neared, it became unfortunately clear that while some schools could open with in-person traditional models, many, even most, might remain physically closed or rely on exclusively virtual learning or a combination of a model that had some students doing virtual learning, some schools in part-time, or were operating under unusual hours or other unusual schedules. So our schools, as well as the community operators who had been providing meals over the summer, really emphasized to us that returning to the traditional program, even with some flexibilities, was simply not going to work and would be so administratively burdensome that a different approach was needed. So we listened to these concerns, and at the beginning of the school year, we extended all of the flexibilities that were available last spring to schools, so they can now operate with whatever model works for them, whether it's the traditional one or the flexible models from last spring or summer. This not only allows schools with the flexibility, but it also allows community partners who also provided meals in many communities in the US to continue doing that. And we have now made these flexibilities available through the entire school year so that schools don't need to worry about the rules of the game, if you will, changing during the school year. So that's how our school feeding programs evolved to meet the challenges of COVID. I also want to describe a few new program options. It became clear early on in the pandemic that there were needs that simply were not going to be met, even with these significant modifications to the school programs. Some schools simply didn't have the capacity to produce or provide meals when they're closed, and some families could not access them due to work, transportation, or other challenges. And these models can be particularly challenging in rural areas. So I wanted to share some additional options which were created and implemented. Let's start with pandemic EBT. As part of that March action that I mentioned earlier, the Congress created a new program in the US called Pandemic EBT. This was an option available to states to allow them to provide benefits to families who had lost access to free and reduced price meals at schools using the EBT system that we use to operate our SNAP program, or the food stamp program here in the US. So families receive cards with a dollar value that can be used for food purchases. And it's equivalent to the amount that students would have received in their free lunches and breakfasts on school days. This program proved highly successful. Every state in the United States opted to develop and run such a program last school year. And it was considered so successful that Congress did recently extend it to cover the current school year. So looking at PEBT's impacts, as I mentioned, it ended up operating in all states. And because of that, it was available to support up to 30 million children who normally rely on free or low price meals at school. Depending on the specifics of the state program and the school calendar in different states, families received anywhere from $250 to $450 per child for the previous school year, with about $330 being the median value. And while there is relatively limited research at this point, there was a recent significant study by the Brookings Institution that found that this program reduced the food hardship experienced by low-income families with children and lifted between 2.7 and 3.9 million children out of hunger. To touch briefly on a couple of other program options, another new program option that was made available was the something called the Meals to You program. It was a public-private partnership, and it was comprised of a university, Baylor University, and private organizations, including PepsiCo and McLean Global, along with states and school districts. This model provided weekly food boxes with 20 meals per box, 10 breakfasts and 10 lunches, to cover meals that students would otherwise receive at school. Boxes were delivered via the US Postal Service and other delivery services, and by the end of the summer, the program had delivered approximately 40 million meals to students in over 40 states. Secondly, the Farmers to Families Food Box is another novel program that was developed specifically to address the challenges. This program is meant to address both the increased need for food support due to the pandemic, as well as the economic challenges posed to producers and food distributors. Through this program, USDA partners with national, regional, and local food distributors to purchase fresh produce, dairy, and meat products from American producers. And then the program requires the distributors to provide food boxes of fresh fruits and vegetables, dairy products, meat products, or combination boxes in family-sized boxes. These boxes are provided to food banks, community and faith-based organizations, and other nonprofits. USDA has contracted for over 100 million of these boxes. So I just want to conclude by, first of all, making you aware that we do have a very detailed website that provides our information about responses in the US. And then finally, going forward to address the question I think that Bibi posed to us all, I think that the key learnings from the US experience are, number one, and this is, I think, similar to the themes you heard from some other presenters, the need to utilize multiple modes to reach those in need. As I mentioned, we had multiple approaches: food provision by schools, use of EBT cards, use of direct delivery of foods and commodities. And we found that to be really necessary to meet the needs of every community. And secondly, the need and the willingness and the ability to adapt quickly to changing circumstances. I think we've probably all learned that under the current circumstances, knowing when and how schools, schedules, and situations will change and where they'll be even a couple of weeks or months from now is very challenging. So we need to be as nimble as possible and try to respond to those changing circumstances. So I thank you for the time and look forward to further discussion in the question and answer period. Thank you, Bibi.
Thank you very much, Cindy. You touched on a very important point for me, which I think a lot of countries and national governments have to bring to bear. The fact that the US school meals program is not about the government of the day, but it is embedded in policy. so that whatever happens, whatever changes, the students do not get disadvantaged. So going from many months of the USDA school meals program, it is very impressive to see the nimbleness, the flexibility, and the innovation around how you continue delivering school meals to those most in need. And what I thought was also interesting was how the program is being implemented in not just a select number of states, but in all the states. And it is about ensuring that indeed we engage the communities, you engage the farmers, you ensure that everybody plays their part. So thank you for bringing out those very succinct issues and highlighting the importance of governance, the importance of continuity, and the importance of innovation and flexibility. Once again, thank you very much, Cindy. And please, participants, please make sure that you do post your questions in the Q&A as well as the chat. Don't be shy. Like I said, our panelists are very able to address your questions. So now, moving right along to another part of the world, in South America, I have the pleasure, and please make sure that you switch the translation to accommodate Karine, who's going to be speaking in Portuguese. Okay? So, Karine Silva dos Santos is from the FNDE, or National School Feeding Program of Brazil, based in Brasilia. Karine has a long career in working with the Ministry of Education around school meals programs, and interestingly, in Brazil, the Social Protection and School Meals Program is comprised of about 17 to 19, if I'm not mistaken, different systems, different programs that come together to address a common objective, a common issue. So Karine is going to be speaking to us this afternoon about exactly the Brazilian model, the program, and how civil society oversight. They've developed an app that people are using to be able to afford the school meals program, to track what is happening across the different states, across the different schools, particularly in the public schools, so that the app is able to help government to deliver, states to deliver, and communities to understand, and all the beneficiaries to be able to understand exactly what is happening. So Karine, boa tarde. You have the floor. Over to you. Please switch to the right channel, participants, so that you can pipe in the right language of your choice. Over to you, Karine. Muito obrigada.
A alimentação escolar é coisa séria. Por isso, o Ministério da Educação e o Fundo Nacional de Desenvolvimento da Educação lançam hoje um conjunto de ações de transparência, participação social e controle do Programa Nacional de Alimentação Escolar. Entre as ferramentas, destacamos o IPENAI, um aplicativo onde pais, alunos, professores, nutricionistas, conselheiros da alimentação escolar e toda a comunidade poderão acompanhar e avaliar a alimentação escolar oferecida nas escolas públicas de todo o país. Para participar, é só baixar o aplicativo, fazer o cadastro e escolher uma escola da sua região. Aqui, você terá informações sobre os valores repassados pelo governo federal, receberá dicas de alimentação saudável, além de poder aprender bastante enquanto responde ao quiz interativo. Todos aprendem jogando e quem participar mais será reconhecido com base na quantidade de interação. Todo mundo pode participar. Você dá uma olhada nas escolas e escolhe aquela que irá acompanhar de perto, através de comentários, envio de fotos e curtidas. E o mais legal é que você poderá falar diretamente com o nutricionista do seu município e com o Conselho de Alimentação Escolar, o CAI, que é o responsável pelo acompanhamento e monitoramento da alimentação oferecida em cada escola. É isso mesmo! Você vai poder dizer como anda a qualidade do que é servido na escola que você acompanha. Boa alimentação também é cidadania. Participe e contribua para a construção de um país melhor para todos. www.fnde.gov.br
Obrigada, Bibi. Bom, primeiramente eu gostaria de agradecer ao convite do GCNF, gostaria de agradecer aos demais colegas pela explanação de cada um deles. Vocês acabaram de poder conhecer um aplicativo recém-lançado pelo governo brasileiro para acompanhamento da Política Nacional da Alimentação Escolar. Antes de falar um pouco sobre a importância da participação social, principalmente nesse momento de pandemia em que vivemos, eu queria relembrar como é que se dá a execução dessa política no Brasil, quais são os nossos números. A Política Nacional da Alimentação Escolar ela é bastante impactante, estruturada, né? Nós temos um programa com 65 anos de existência, então eu queria falar um pouquinho desses grandes números para vocês. Pode passar, por gentileza. Ryan, next, please. Thank you. Então, eu trago aqui a universalidade do atendimento e é importante a gente perceber que no Brasil, mesmo no momento da pandemia, nós não falamos em atendimento apenas aos vulneráveis ou às regiões socioeconômicas com alguma dificuldade, né? Nós atendemos os 26 estados, mais o Distrito Federal, que é da onde eu falo, os 5.570 municípios, com aí uma rede de escolas, né, públicas da educação brasileira na ordem de 150 mil. E com isso, atendemos mais de 40 milhões de estudantes. Então, durante um único dia, esse estudante, né, estando na escola ou não, porque agora as aulas estão suspensas, a gente chega a ofertar mais de 50 milhões de refeições. É interessante perceber que esse regime só é possível, né, a execução dessa política com esses números tão impactantes, só é possível porque nós trabalhamos num regime de colaboração. Então, o governo federal é quem repassa esses recursos para os governos estaduais e municipais, recursos complementares, e dita, né, e gerencia os regramentos, as diretrizes, a legislação sobre a execução dessa política. Mas executar a política de alimentação escolar no Brasil, dada o tamanho do nosso território, não é? Só é possível porque trabalhamos em regime de colaboração. Para além do regime de colaboração, que é uma estrutura administrativa, a gente precisa contar com a participação social. E é por isso que a gente trouxe o aplicativo como um exemplo, né, de avanço no acompanhamento, fiscalização e participação da comunidade escolar nesta política pública tão importante, principalmente agora, em que a gente vive esse momento em que os alunos estão com as aulas suspensas e muitos deles não têm outras refeições, outro alimento, né, a não ser aquele da escola. Próximo, por favor. Ryan, next. E eu queria relembrar quais são as diretrizes dessa política, porque todas essas diretrizes, elas foram mantidas mesmo com a alteração da legislação em função da pandemia, né, do novo coronavírus. Então, o direito humano à alimentação adequada é uma das nossas diretrizes, o eixo, né, da segurança alimentar e nutricional nos traz isso como fator essencial para a execução da política, a oferta de alimentação adequada e saudável. O nosso intuito é que a gente garanta, né, dois grandes eixos, que é a oferta em quantidade necessária, suficiente para aquele estudante, mas também que essa alimentação seja saudável e adequada. O eixo, né, da educação alimentar e nutricional, entendendo o espaço escolar e hoje o espaço de se alimentar, né, no ambiente familiar, também como promotor de formação de hábitos alimentares mais saudáveis, entendendo que isso vai perpetuar toda a vida daquele indivíduo. O atendimento universal, como eu mencionei aos senhores, e aí no atendimento universal nós temos alunos, né, alunos das escolas urbanas, escolas rurais, comunidades indígenas, comunidades quilombolas, comunidades de ribeirinhos, dos ribeirinhos, toda a nossa comunidade é atendida. A participação da sociedade civil, para isso, para executar, né, a política da alimentação escolar, que a gente conta com um conselho de alimentação escolar, que são membros, né, advindos da própria comunidade, como o pai do estudante, o professor, a nutricionista, né, que acompanham essa política. E hoje, tem essa ferramenta, essa estratégia, né, de um aplicativo para acompanhar isso. Eu vou falar sobre o aplicativo um pouco mais à frente. E o suporte, né, o nosso estímulo ao desenvolvimento sustentável a partir da agricultura familiar. Então, desde 2009, nós temos uma lei que obriga, né, que traz como regramento a utilização de pelo menos 30% dos recursos do governo federal que são destinados à alimentação, que eles sejam, então, especificamente destinados à agricultura familiar, ao pequeno agricultor. A gente sabe que é por meio da agricultura familiar, que a gente consegue inserir e fornecer alimentos, né, mais frescos aos nossos estudantes, alimentos in natura. A gente favorece os circuitos curtos de produção, então se produz perto da escola, perto daquela comunidade. A gente favorece também o desenvolvimento econômico local. Então, essas são as diretrizes do nosso programa e todas elas foram mantidas mesmo durante o momento da pandemia da Covid-19. Próximo, por favor, Ryan. Thank you. E aí nós nos deparamos no início do ano, em março, a primeira rede pública de educação no Brasil que foi suspensa é exatamente a rede do Distrito Federal, onde eu resido. Então, as aulas foram suspensas aqui no dia 13 de março, e o governo federal, ele se reuniu num comitê estratégico operacional com vários órgãos, Ministério da Educação, Ministério da Saúde, Ministério da Agricultura, participação representantes, né, dos municípios, representantes dos estados brasileiros, para que a gente pudesse pensar e idealizar estratégias de combate às consequências, né, da pandemia que começávamos a viver lá em março. Então, em função desse comitê, foi pensado, então, a alteração da nossa lei, a Lei 11.947 de 2009 foi alterada pela Lei 13.987 de 2020. Em consequência disso, tivemos a alteração da resolução, a publicação da resolução número 2 de 2020 e também guias orientativos, perguntas e respostas para atender essa alteração da legislação. E o que essa alteração trouxe? A possibilidade, a flexibilidade de que o gestor municipal e estadual pudesse continuar comprando gêneros alimentícios com recursos do governo federal e elaborar kits de alimentos e fornecê-los aos nossos estudantes, mesmo durante todo o período de suspensão das aulas. Então, com menos de 30 dias da pandemia, por volta de 20 dias, após o fechamento da primeira rede pública do Brasil, nós já tínhamos a alteração da lei, a alteração da resolução, indicando qual deveria ser o caminho que as redes municipais e estaduais poderiam seguir durante esse momento. Próximo, por favor. Next. E essa lei trouxe, então, a flexibilização da oferta a partir de composição de kits de alimentos. Mas percebam, esses kits precisavam necessariamente continuar seguindo as diretrizes do programa, então era necessário que houvesse um planejamento pensando na faixa etária daquele estudante, no período em que ele ficaria na escola, se as aulas estivessem acontecendo, pensando nas necessidades alimentares que poderia, né, acontecer com alguns dos nossos estudantes. A elaboração desse cardápio para a composição desse kit precisa ser feita necessariamente pela nutricionista responsável técnica pelo programa. Dentro desse kit, nós continuávamos, então, a garantir as nossas diretrizes. O atendimento universal, então, aqui não há que se falar em atender só os vulneráveis, só a comunidade indígena, ou só os quilombolas, a gente continuava atendendo a toda a rede, a priorização dos alimentos da agricultura familiar. Então, não é porque tratávamos de kits de produtos, de alimentos, que poderíamos colocar nesse kit apenas alimentos processados ou ultraprocessados, não. Ele precisaria ser composto necessariamente por alimentos in natura e minimamente processados, e a agricultura familiar traz isso, inclusive garantindo a diversidade de alimentos. O Brasil tem uma territorialidade muito grande e o que se come, por exemplo, na região norte, uma das nossas frutas aqui, o açaí, não é o que se come, por exemplo, na região sul, num café da manhã, por exemplo. Então, a gente precisava garantir a diversidade de alimentos na composição dos kits e seguir, né, estar seguindo todas as recomendações do Ministério da Saúde, da Organização Mundial de Saúde, quanto a entrega do kit deveria ser feita garantindo o distanciamento social, a parte de utilização de equipamentos de EPI por quem estivesse fornecendo esses kits, a possibilidade de utilizar, por exemplo, estratégias diferenciadas na hora da entrega do kit. Eu cito, esse kit ele poderia ser entregue na própria escola, por parte da coordenação da escola, por parte dos nutricionistas, merendeiros, eles poderiam se organizar. Esse kit poderia ser entregue na residência do aluno, na casa do estudante. A gente poderia utilizar equipamentos de assistência social que nós temos em todos os municípios do Brasil para também contribuir na distribuição desse kit. Então, a gente abriu um leque de oportunidades, de estratégias, né, para que fossem garantidas para que fosse garantida a manutenção de acesso aos alimentos durante o momento da pandemia. Próximo, por favor. Ryan? Isso. E aí, a alimentação escolar, né? Os alimentos advindos da alimentação escolar, eles estão acontecendo, as entregas estão acontecendo, e neste cenário, a gente concluiu que seria muito urgente e importante que essa comunidade escolar tivesse a possibilidade de acompanhar isso, né? Então, nós temos aí o aplicativo chamado EPNAI disponível para todos os celulares, né? Então, qualquer cidadão, pai do nosso estudante, o agricultor familiar, nutricionista, o aluno, que é o nosso público-alvo, né, poderia acessar esse aplicativo e ter, então, informações sobre a execução dessa política. Quais são os valores que foram repassados, conversar com essa nutricionista, tirar dúvidas sobre o cardápio, tudo isso é possível no aplicativo. Próximo, por favor. Já estou quase terminando. Next. Next, please. E aí eu quero trazer essa última imagem para poder falar. No, please. Back. Eu queria utilizar essa última imagem, thank you, para poder falar sobre a importância da intersetorialidade na execução da política da alimentação escolar no Brasil. Nós tivemos aí a participação e contribuição do Ministério da Saúde, do Ministério da Agricultura, também no Ministério das Relações Exteriores, né, que nos proporciona essa ampla discussão da política de alimentação escolar com outros países no âmbito dos nossos projetos, né, dos nossos acordos de cooperação técnica com a Ásia, com a África, com a América Latina, Caribe, com os nossos parceiros, FAO e PMA. E queria ressaltar aqui o trabalho grandioso que o Ministério da Defesa, o Exército, vem realizando, especialmente na região norte do Brasil, em relação à logística de entrega desses kits. Percebam, né, que a gente tem a comunidade indígena indo buscar os kits de alimentos, as crianças, a gente faz essa entrega no leito do rio. Então, é uma logística muito grande. E queria ressaltar que na composição dos kits, a gente consegue garantir os alimentos minimamente processados e in natura, especialmente por parte da agricultura familiar, como vocês podem visualizar aqui na apresentação. Eu queria parabenizar a todos os países envolvidos, né, nessa temática que é a alimentação escolar, que é um diferencial de política pública no mundo inteiro. Meu muito obrigada, eu sigo à disposição.
Thank you very much, Karine, first of all, for the video showcasing the app and also for running us through a very interesting model of Brazil's long-standing school feeding program. I've had the pleasure myself of being in Brazil and moving around the States and witnessing how actually the 30% commitment, for local sourcing actually works. And it's interesting that you highlighted the need for contextualizing the menus so that they represent not only different states, but also different cultural expressions and appreciations of what should be had. And I like also, again, similar to the United States example, that in Brazil, the school food nutrition program is a law. It is embedded in the very tenets of what the country seeks to provide. And also looking at, the very interesting angle around the human rights approach. I very much like that. And then, of course, the intersectionality and intersectorality of how Brazil is planning its program so that all the key stakeholders are playing their part, they know exactly what to do, and they are held accountable for what they should be delivering. So once again, muito obrigada. Okay, now I'm going to be relying on the guidance of my technical team behind the scenes. We have about 10 to 15 minutes to wrap up, and we don't have that many questions on the chat or Q&A. However, there are two questions that have come up that I believe Carmen and Cindy can address, and then I'll have a specific question for Rafael and for Karen. So the first question is around how did the USDA organize the local voucher system? Well, at local level, getting the voucher system to work effectively. I think that's specifically for Cindy, in the US. And then the other question, which both of you, Cindy and Carmen can address, is the mode of money transfers during the lockdown to make sure that children continue to be fed and nourished. Okay, so those are the two questions for Cindy and Carmen. Now, Carmen, I have a specific question for you, which is, in non-WFP countries, how do you actually reach out to these countries in the context of COVID and beyond to render WFP's technical support and continuity around building the requisite capacities? So over to you, the both of either one can start, and then I'll move to Rafael and Karine with my specific questions, and then looking at also some of the comments that are coming up. Over to the both of you.
Thank you so much, Bibi. Maybe let me just get that first question that you mentioned. And as the pandemic expanded, I would say, and as the spring turned into summer, we started to understand that not only the countries that received WFP's direct operational support were benefiting from the information that we're putting out, but also other governments. So, for example, the work that we have, the assistance that we have provided to countries that are not traditionally considered WFP recipients of support has been because they have sought WFP out. So the government of Argentina, for example, requested our specific support to design the new guidelines for the reopening of schools and the restoring of school feeding programs with more safety and hygiene measures and what needed to be done in terms of local government guidelines and regulations and all of that. So over the summer and part of the spring and the summer, we worked with the government of Argentina to provide that kind of specific support to their program. The same has happened in other countries where WFP has provided essentially technical assistance and support. But I would say a lot of the guidelines, a lot of the recommendations, suggestions that we're making is really based on what governments themselves are doing, studying what the US has done. And so we've been following very closely what Cindy has presented in terms of the US's really creative and quite diverse way of responding to the pandemic. The UK also has interesting experiences in countries, as I mentioned, like Costa Rica and others. So our effort over the last few months has been not just studying what WFP has done in different countries, which has also been quite interesting in its diversity, but also specifically studying and following and documenting what governments have done, and all of that is available on our website. So that's essentially how we've handled it. In terms of the question on cash transfers, when it comes to funds that WFP handles, and those are funds that are basically handled on behalf of our donors, very generously provide us with the means and the capacity to support countries, among those, of course, USDA and others. It really depends on our conversations with the donors and the regulations that the funds are tied to. So there are some donations and access to funds that WFP has that are much more flexible, for which we have used and transformed them into cash and vouchers, for example. The cash goes through WFP's scope system directly to communities through either cell phones or cards that can be redeemed locally. The vouchers also happen electronically through either cards or different kinds of digital solutions that we found depending on the context. And in other cases, we are bound by more rigorous regulations, and so we have, as I said, looked for those meals to be converted into take-home rations, and it really depends on working donor by donor on what we're able to do. Now, governments, of course, have the restrictions of their own legislations, their own legal frameworks, and what they can and cannot do. But we have seen in several countries the merging or the leveraging of existing cash transfer programs of other safety nets. So the government of Armenia, for example, already had an ongoing cash transfer program, and they leveraged that on top of the school meals program to make sure that those families got additional support. So that's how we've also seen some of the strategies being piled up, or different parts of the safety net programs of the government being connected and integrated to make sure that these families get support. Over to you.
Thank you very much, Carmen, for elaborating on the two questions. Now, Cindy, similar question to you. However, I happen to have had the privilege of studying in Appalachia and knowing the infrastructural limitations. So how do you actually deal with the issue of delivering services where the hardest and the marginalized actually reside? Over to you.
Okay, thank you. So I'll start with the last question, actually. As I mentioned, and I think many of the panelists have mentioned, really the multimodal approach was necessary to address all the needs in the country, and the circumstances you just described are a big part of why that was true. Is that in some parts of the country it can be difficult, transportation can be difficult, and access to meal pickup at school or whatever it might be is challenging. So in terms of the delivery of meal boxes through the several mechanisms I described earlier, utilized our existing mail and distribution system. So the U.S. Postal Service, as well as the private but extremely extensive services like Federal Express and USPS, and which of those systems was used was really tailored based on local circumstances. To get back to the original two questions, the first I think was about how did the transfer program, the card program, work at the local level. And it was really a two-part program. This is the PEBT program I mentioned earlier. First of all, at the state level, the SNAP agency, the agency that runs our fundamental food assistance program, SNAP or food stamps, worked with either at the state level or at the local level with the education agency to develop a means of identifying the children who would normally receive free meals at schools, so that because they were the ones who were able to receive this assistance. And in some cases, there were wonderful data sets available, and they were able to really just do it just transfer the data over and provide SNAP cards to these students. In other cases, it required an extensive effort to gather up data from the local school level, create a database, and provide that to the SNAP agency and issue cards. The cards were issued in two ways. Either some of the families who rely on free meals are SNAP participants, and that was in some ways an easier process because their benefits were added to their existing cards. There were many additional students, though, that are eligible for free meals that are not on SNAP, and those families were issued new cards. And then once we benefited greatly by the fact that the SNAP infrastructure to run an EBT-based card program already existed. And I thought several times as we were rolling that program out, whether this would have been doable if we didn't have that. And I would be very interested in hearing from other countries that did utilize some kind of a card-based approach as to whether that's on something that was already in existence or that was sort of built up for the purposes of providing COVID-related assistance. And then, finally, to the broad question about how to get cash transfers to families. In the U.S., it really was the closest thing to a cash transfer was the PEBT program. I didn't mention it in my presentation, but part of the COVID response here too was also to provide some additional benefits in the regular SNAP program. So in those two ways, a cash-like benefit for food was provided to families. And the other modalities that we relied heavily on were the provision of meals in boxes to households in some format, and the provision of meals through pickup through school or community providers.
Thank you very much, Cindy, for highlighting those very important points. And now I would like to turn to Rafael and then Karine. So Rafael, your program or what you presented around, Tetra Pak, Tetra Laval, and the school milk, I think, of course, it is assuming that those cultures and traditions are milk consuming or dairy consuming. Now, what about extending your reach to countries that are not generally or naturally dairy consumers? How do you get around that to ensure that the message of the benefit of dairy reaches the community, reaches the people, and is actually propagated by nutritionists? So that's to Rafael. Now to Karine, there's a question around, of course, the app that you presented is beautiful and it seems to be really engaging with the civil society and the community. But what about in instances where there's a digital divide and there are huge inequities within the society? They cannot even access, let's say, electricity. They don't have the data. They don't have the internet. How do you think this app can be useful and can be replicated in other countries? Over to you, Rafael, first, and then to Karine.
Thank you very much, Bibi. Great question. I'd just like to inform everyone, whoever hasn't seen it, that the IDF has just launched a very good study on school milk programs around the world. It states that 160 million children in 62 countries receive milk as part of the school meals program. We are currently working in 56 countries, as I mentioned, and 68 million children receive the vast majority of milk or other nutritious beverages. Now, our approach is to work in partnership and collaboration with the local key stakeholders. Working with the farmers, we also provide technical assistance and training to local dairy farmers and local smallholder farmers that supply milk to our customers who process and package the milk to deliver to the schools. And then we also provide training and technical assistance as with sharing all the best practices and learnings that we have. And within those best practices and learnings, we also provide data on the importance of milk, the nutritional, all the nutrients that it has, of course, all of the impact data from the programs, which are very important, linking everything back to the smallholder farmers so that everything can be measured. So job creation, for example, nutrition improvement, the school attendance results, the milk consumption patterns, because as the school milk programs grow in new countries, you develop a milk consumption habit, and which also benefits local agriculture development and the local smallholder farmers. So we provide our experiences and our trainings throughout the whole value chain, and really work with the local authorities, our customers, all the key stakeholders to ensure a successful value chain approach. It's our focus, and to ensure safe and quality nutrition for the kids.
Thank you very much, Rafael. I mean, this has been a question that has been plaguing me, for the longest time. I mean, when you want to engage the private sector and making sure that, government actually jumps in and supports the program, how do you do that in a very different and challenging circumstances? Now, Karine, just to repeat the question, how do you handle, a situation of ensuring that the app is utilized in a situation of a digital divide? And this question actually came from South Africa, because as we know, Brazil and South Africa has such similarities in terms of the disparities, and the Gini coefficient. So over to you, Karine.
Obrigada, Bibi. Então, eu vou falar um pouquinho da realidade no Brasil, no que nós temos feito em termos de projetos. Nós temos 2 grandes projetos e que estão em fase de implementação. Um se chama Educação Conectada, que é uma política pública desenvolvida, pelo Ministério da Educação, e a ideia desse projeto, ele já está em andamento, é levar conectividade a todas as escolas do Brasil, 150 mil escolas. Para que esse projeto possa, de fato, ter êxito, ser eficiente, nós contamos com a parceria, por exemplo, com o Ministério da Defesa, o Exército, para a implementação de cabeamento na região amazônica. Isso é um exemplo. A conectividade das escolas, ela iria funcionar e vai funcionar não só no ambiente escolar, mas em toda a região próxima à escola, A gente sabe que sim, temos uma parte considerável da população brasileira que não tem acesso à internet. Ainda que os celulares hoje, estejam comuns nas mãos dos brasileiros, a conectividade é uma grande questão, O acesso a dados, o pagamento da internet mensal, isso tem sido discutido muito. E esse programa, Educação Conectada, vem no sentido de ampliar a conectividade das escolas para além dos muros da própria escola, que a gente possa pegar a região. Para além disso, o governo federal acabou de repassar 615 milhões para as escolas públicas do Brasil, no sentido de favorecer e facilitar o retorno às aulas. Com esses recursos, as redes escolares também podem promover a conectividade e aquisição, inclusive, de equipamentos, de tecnologia, infraestrutura de tecnologia. Então, são 2 projetos que estão em andamento no Brasil para que a gente possa, de fato, gerar aí o acesso necessário a esse mundo digital que a pandemia acaba nos impondo. Agora, eu queria só ressaltar a importância das parcerias que são realizadas. Nós não conseguimos, o Ministério da Educação não faz isso de maneira isolada. Então, nós trabalhamos com o Exército, trabalhamos com o Ministério da Ciência e Tecnologia, trabalhamos com o Ministério aqui da Economia, que é quem lida, cuida do orçamento público aqui no Brasil, porque há, de fato, precisa haver, de fato, um interesse dos governantes na destinação destes recursos, entendendo que, sim, nós temos parte da população que não consegue ter acesso à conectividade. Obrigada.
Thank you. Thank you very much, Karine. I think that's very important and very interesting to be able to, as you develop any tool, any app, to accommodate all the different challenges, infrastructural and systemic or otherwise, to ensure that, everybody has access to such a system. I don't see much questions from the inbox. So in the interest of time, with Ryan's permission and the GCNF team, let me attempt to just summarize what I think I heard in terms of the key messages bubbling up to the surface. Of course, we are dealing with a very interesting time of COVID, whereby many systems are not able to provide the necessary services in the traditional way that we know them. So what is happening and what has to happen is that in terms of policy preparedness and program preparedness, governments have to ensure that they have legal instruments that commit them to having a nationally run school meals, school health, and school nutrition program for purposes of continuity, for purposes of inclusion, and secondly, alongside the same thinking, when you have such a legal instrument, it commits you to invest for the immediate, for the medium, and the long term, and to monitor the progress and to hold each key sector accountable. And then thirdly, what I've heard was that the importance of partnerships cannot be underestimated, underrated, and taken for granted. From across the UN system to other development partners, to the private sector, and to civil society, how do we make sure that we strengthen these partnerships during COVID and post-COVID, acknowledging that, indeed, early warning systems and managing any emergency into development is critical for any development agenda and for any immediate action. And what I had coming out very strongly are three sort of keywords: adaptation, flexibility, nimbleness, and maintaining scale regardless of the challenge of COVID. How do we manage this? The fourth point that I heard is that of taking advantage of IT and probably social media and other technologies and innovations at hand to expand the programs, to advocate for the programs, and to make sure that there is reach at scale across different societal levels and different, rural versus, modern society, if you wish, urban society. And then, last but not least necessarily, I think continuity of policy and programming from the national or state level, federal level, if you wish, to the state, to the provincial, district, and local is very critical. But I think alongside this, we cannot do anything unless we learn to build on the lessons that already exist, expatiate on these lessons, and then build capacity at the requisite level for action in a timeless fashion, for action that is impactful, and indeed for understanding how we move into the next phase post-COVID and otherwise. So with that, ladies and gentlemen, before I hand over to my partner in crime, Ryan, and the GCNF team, let me thank them very heartily for this opportunity of being at the forefront of convening the Global Child Nutrition Forum year in and year out, and ensuring that the GCNF actually grows by leaps and bounds. Secondly, we could have not done this without our very well, or my very well appointed panelists, Carmen, Cindy, Rafael, and Karine. A huge thank you to you all for imparting the knowledge and ensuring that everybody is on board about what is happening and how we should be moving forward. Of course, if we didn't have the interpreters, everything would be getting or would have gotten lost in translation. So thanks to the French interpreters, English interpreters, and Portuguese interpreters. Thank you very much. We appreciate your services today and going forward. Without you, the participants, how could we have such a program? It is about you supporting the GCNF. It is about you availing yourself to share lessons, to listen in, and of course, there will be a recording that will be shared through a link of all the presentations, all the videos, and all the key other chats that came through in the chat box and the Q&A. And let me just, note one or two things. This is a very auspicious day for me because not only is it my birthday, but it also happens to be the big day in the US for the election. So what a coincidence. And I can only say I'm really honored and I've enjoyed this session. I've enjoyed you panelists. I've enjoyed you participants. And thank you once again to the GCNF and the global family on school meals, school health, and school nutrition. So I hand over to you, Ryan. Thank you very much for coordinating this and running with this very smoothly.
First of all, Bibi, thank you so much for sharing your birthday with us on this day and joining us and leading such an engaging panel. And just to reiterate all of the incredible thanks and gratitude that Bibi has shared around to all of our panelists, to Rafael, to Karine, to Cindy, and to Carmen for joining us today to share on your learnings to this global community. And as Bibi said, thank you so much to our forum participants for joining us in this virtual setting, for committing to the goals of the forum of free information exchange, committing to the importance of collaboration, and even when things aren't going perfectly according to plan, as we all know, as we watch these sessions through our computers and our laptops and our phones, still remaining committed to the importance of what the forum offers to our global community. And so as a reminder of some of these key points in partnership and collaboration, and talking about our programs and prioritizing the importance of health and hygiene for our children during this trying time, I encourage those participants who are just beginning their day to be sure to tune back in to later workshop opportunities in fortification and biofortification. We're starting off our workshop series in health and hygiene with Catholic Relief Services and Save the Children starting today, and we'll be running another session next week. And for those forum participants who have not yet had the opportunity, I encourage you to look at the virtual agenda and join us in one of our communique drafting sessions, where our drafting team is hard at work drawing together input from our panelists, from government officials around the world, from committed stakeholders in the nonprofit and private sector to ensure that this forum communique represents the voice of this year's global community, and it can serve as a critical tool for all of us moving forward as we seek to advocate for the importance of school meal programs and imagine what school meals can look like moving into the future. So thank you all for having joined us today, and we look forward to seeing you in sessions moving forward.